This morning on Today's Moms, a dangerous trend, pregnant women who appear to gain very little weight over the course of 9 months. NBC's Mara Schiavo-Campo has more on this. Mara, good morning.
Good morning, Ann. You see it virtually every time you open a magazine. Pregnant celebrities with a barely there bump who drop back to their normal sizes within weeks. Experts say while those images may be glamorous, they set unrealistic goals for so many women struggling to lose that baby fat. Eve DeRose loves being a mom.
There we go.
But after gaining a combined 70 pounds during 2 pregnancies, she wasn't happy about her post-baby bulge.
I absolutely felt blah.
Making things worse for her, glossy magazine photos of celebrity moms dropping the weight in the blink of an eye.
I'd see these other moms who had their babies the same time I did, and they were on the beach. And I certainly was not ready to do that.
These days, those images aren't hard to find. Celebrities whose baby bump looks more like a blip, staying fashionably thin throughout their pregnancies. Like stylist Rachel Zoe walking the red carpet at 8 months. Or royal wedding guest Victoria Beckham barely showing at 7.5 months pregnant. And then there's the well-documented rebound.
This woman just had a baby. It's out of control.
With millions watching, model Heidi Klum proudly strutted down the Victoria's Secret catwalk just 6 weeks after giving birth. Reality TV star Bethany Frankel posed for Us magazine in a bathing suit just 1 month after having her daughter, later talking to Today about her body image during pregnancy.
I was distorted and deformed and swollen.
Barely there bumps have become so common, some maternity clothing sites are now selling size 0. And workout gear moms can wear well into their 3rd trimester. Experts say all of these images set unrealistic goals and are giving lots of new moms the baby blues.
So the more that women are fed this mythic notion that they can be skinny right after giving birth, or they should look skinny while pregnant, it absolutely can have a devastating effect on a woman who's very highly conscious about her weight. At its extreme, onlookers have created a buzzword for the trend, mommyrexia. Though not a medical diagnosis, doctors say if taken too far, gaining too few pregnancy pounds can also be bad for the baby.
These children who are growth restricted at birth may be at increased risk of developing long-term developmental issues and hypertension.
After having her last child, new mom Eve DeRose started working with a trainer who specializes in postpartum fitness.
You know, this was a 9-month process. It's going to take at least that time to get you back to where you were.
She's now back to her pre-baby body thanks to a healthy approach, physically and mentally.
Don't be stressed about it because it will just come gradually. Billy fanatic, he's moving.
Now, doctors stress that a normal weight woman should gain between 25 and 35 pounds during pregnancy and expect to be back in those skinny jeans a year after giving birth. That's a far cry from what we so often see with those celebrity moms. Ann?
It's a good idea to give yourself a year. That's also especially good information for you, Mara, as I know you're expecting your own bundle of joy.
Correct.
Mara Schiavo-Campo. Thank you. Dr. Catherine Berndorf is the reproductive psychiatrist at New York Presbyterian Hospital, Weill Cornell Medical Center, and Dr. Nancy Snyderman is NBC's chief medical editor. Good morning to both of you. Biggest risk of gaining too little while pregnant, Nancy?
Well, you starve your fetus. It's not good for the baby. Overeating and undereating, they're both bad. But I think it's important to remember, at a time when we're talking about Africa's greatest famine in 60 years, I find this particularly vulgar, this whole idea of thinking your body is deformed while you're pregnant.
Do you agree that there is an unrealistic standard being set by celebrities?
Absolutely. I think that people want healthy babies. You have to be a healthy mom to have a healthy baby, and that means maintaining a healthy weight.
Okay, so the amount of weight you should have is between 25 and 30 pounds, is that
I mean,
right?
like some women may only gain 15 to 20 pounds if they're light build, and some women do gain more. I gained 40 pounds with each pregnancy. So there are norms per woman, but the average is a 25 to 30 pounds.
We want to stay healthy, however, we want to exercise when
Oh,
we're
look,
pregnant.
you can exercise all the way through pregnancy.
How much is too much? How much is too much?
I think it depends on your build, it depends on your genetics, but you can talk to your doctor about what's appropriate for you.
and you want to stay within a range that makes sense. If you're losing too much or gaining too much, like you said, both are issues.
But it's hard to know, especially your first
look,
time.
if you already run 45 minutes a day, keep running 45 minutes a day. But don't start adding another aerobics class and then this and that because you want to counter your appetite, or you think you should only gain 7 or 8 pounds. But exercise during pregnancy is absolutely normal, healthy, and frankly, it's good for you.
And how you think about it is important.
Right.
Do you have disordered thoughts about what you're eating and how you look? Is your body image distorted? So if you're feeling particularly obsessed about how you look, I don't look thin enough, or I look too fat, talk to somebody about it.
You know what really makes me crazy about all of this is we talk about Julia Roberts and the fact that she gets airbrushed. Then we talk about women who during pregnancy think their bodies are deformed. We have become cuckoo about hating our bodies and this self-loathing. Pregnancy should be 9 months of root beer floats and bliss and deal with it afterwards. I think this is an Upper East Side white girl obnoxious problem.
Strong statement.
Well, it's irritating to me. We want perfect babies, we want perfect bodies, we want perfect lives. I mean, I just find the whole thing vulgar.
I agree. And I think
Vulgar.
we can't glamorize a lethal psychiatric disorder. Anorexia and bulimia.
Yeah.
I have women in my practice who vomit throughout their pregnancies to maintain weight. Obviously, that's not healthy.
Because actually, pregnancy should be one of the most
Celebrated.
delicious,
And let me tell you, for the women who
times.
can't get pregnant right now, they're not liking this segment. So let's get real.
Thanks. Back after this.